Hello everybody, my name is Asandobuya. In this my topic, I'm going to talk about managing of wounds and bleeding. Hello everybody. Yeah, I'm going to talk about wounds and bleedings, right? What is wound? A wound is the break or a damage in the continuity of the skins, either internal or external cuts. Types of wound. There are different types of wound. You have internal bleeding, which is called closed wound, right? Is caused by damaging the capillaries, bleeding upper the skins. It's often because by the trauma to the part of the body, often caused by a blow or fall, usually visible appear as a blue purple or a purple black coloration. What is external bleeding? External bleeding is caused by the tearing of tissue and results to an open wound, usually visible with a bleeding, either minor or major bleeding. These are the type of bleeding. Then you have internal wound, right? Internal wound is a bruise or contusions, is caused by damaging capillary bleeding under the skin. It will often be caused by trauma to the part of the body, often caused by a blow or fall. Usually, a bruise will be visible, appear as a blue purple or a purple black coloration. It can also be caused by fracture that have a puncture blood tissue or vessel, muscle or tissue or organ. We're talking about management, right? How we can manage this one. We call rise, R-I-C-E. What is the meaning of rise in wound, in the management of wound? Rise mean the R stand for rest the injury part. Then the I stand for ice application. Then the C stand for compression on the injured part. Then the E stand for elevate the injured part. Yeah. So this simply means that the R rests in the injury, like if you are giving treatment, right? You have to press where the sore is, right? They have to put like ice application for to stop the blood a little bit. They have to compress it with bandage. You understand? They have to elevate the injured area. You had more gauze or more tissue, right? Then we're talking about external wound. External wound, it simply means open wound. This is where the blood escapes from the circulatory system to the outside of the body. For example, from a wound. It can also be caused by clear cuts from sharp edge, like sharp equipment, or a rough tear or a crush, or a superficial wound from round surface or an object entering the body. Any object can wound someone. There are three types of external bleeding, right? You have the arterial bleeding. What is the arterial bleeding? This is the bleeding from the artery and will be bright and red in color. That is oxygenated blood. This blood will pump from the wound in the time with the casualty heart. Then you're talking about another type is venous bleeding. Venous bleeding, this is the bleeding from a vein. The blood will be a dark red in color. That is deoxygenated blood and will gush or flow from the wound. Then the third bleeding means capillary bleeding. This bleeding that is red in color and slow hustle from the wound or from the underneath the skin, that is bruising, Then you're talking about major bleeding. Major bleeding is major wound are life-threatening due to several blood loss. If they are left untreated, they may lead to hypovolemic shock and high risks of infection and other complications. How you can manage wound management? You have to. I'm going to explain 7 points how we can manage wound. Right? You have to wear a disposable gloves. That is number 1. Number 2, lay the casualty down on the floor to help prevent shock. That is number 2. Number 3, examine the injury of establish the external of the wound. Then number 4, elevate the injured parts of injury allowed. Right? Then point number 5, apply direct pressure to the wound to control the blood, to loss of blood. Then number 6, you apply a sterile dress, sterile dress of the appropriate size for the wound and secure with bandage. Then you can call any first aid, any doctor or any hospital for further checkup. Yeah. Then I'm going to highlight the example of external wound, wherein you will see how external wound look like. Then we're talking about external wound, right? These are major bleeding. They are major bleeding. Major wounds are not life-threatening condition. However, if they are left untreated, they might lead to infection and other implications. How you can manage minor bleeding? Wear a disposable gloves. Then examine the injury by establish the external of the wound. Then clear the wound under the fresh running water, under fresh running water. Then sit the casualty down. If they feel weak, then understand the position of them on the floor. Then elevate the injury parts of the injuries allowed. Then apply a sterile dress or plaster of an appropriate size for the wounded person. Then we're talking about shock also. Shock is the best description as the circulatory failure, that is collapse when the arterial blood pressure is too low to provide an adequate supply of blood to the tissue. As a result of this, the vital organs such as the heart of this person or the brain are deprived from oxygen. Shock can be brought on by a severe loss of blood. Somebody can have shock because of severe loss of blood, loss of body fluid due to burning, excessive vomiting or diarrhea, and reduced blood supply or activity of the heart. Then widespreading of dilution of the veins with insufficient blood to fill them, caused by bacterial or chemical toxic chemical. Then injury to the spinal cord. Then several head trauma that can damage the nerve control, circulation. How we can recognition of a shock? Obvious injury. Then you can see it's pale or gray color. Then rapid but weak pulse. Then weak and confused. They can be nasally and tossing. It can be tossing. Then rapid swelling of breath. Then in managing of shock, how we can manage shock? Managing of shock, um, managing the cause and bleeding or burning of injury. If injury is allowed, lay the casualty down and rise the leg up. Then loosen tight cloth. If the person wear tight cloth, you have to loose the person cloth. Then keep the casualty warm with a blanket or any coat, anything that have it. They have to call the ambulance or first aid group or emergency system. They have to monitor this casualty. If the person have shock, you have to monitor his airway, how he can breathe. You put his head straight. Then do not allow or have anything to eat or drink. Do not allow them to eat or drink anything till the emergency system